Good afternoon, everyone. I'd like to call to order this May edition of the Jail Oversight Board meeting, and if we could all stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item, as always, is our first round of public comments that would be specific to any items that are on the agenda for today. So if there are any members of the public who would like to address the Jail Oversight Board, please come forward and do so. Hearing none. The next item for today is an approval of the April minutes. Is there a motion to approve the minutes?
Motion.
I hear a motion. Is there a second?
Second.
We have a motion and a second. Any questions or comments on the minutes? Hearing none. All in favor?
Aye.
Aye. Any opposed? The ayes have it. Next is an approval of the April reports. Is there a motion to approve the April reports?
Motion to approve report?
Second.
A motion, a second. Questions or comments? Hearing none. All in favor?
Aye.
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 Any opposed? All right. Warden Williams?
Good afternoon, everyone. As soon as Sean helps us, I do have a report that I will broadcast for you as well.
And while you do so, just two announcements I should have made at the outset. One is that with us via hybrid, via Zoom, we have Judge Whalen and we also have Deborah Love. And I'll also mention that we had an executive session immediately prior to this meeting to cover certain personnel issues as well as certain matters of public safety that would be kept in the private. Go ahead.
Thank you very much, Councilman Madden. I'll begin with the coronavirus report. So we are still within a congregate setting, subject to mitigation measures to ensure that disease transfer does not occur or that we are dramatically reducing that opportunity. So within the facility, all of us are still masked. And we do ask that visitors that come to our facility observe that as well. It is a requirement upon entry. We are providing masks to the incarcerated population as well. In the month of April of 2022, 201 incarcerated persons were tested utilizing PCR tests for COVID-19, and these were conducted for purposes of transfer. 0 out of 201 were diagnosed as positive with COVID-19. And that is something to celebrate, but it is important to note that there are definitely increases that are being seen throughout the Commonwealth of Pennsylvania. We are being very mindful of continued mitigation measures within the facility so that we can maintain no positivity rates. We did not conduct any vaccinations in April. This is something that I think is a missed opportunity that we need to address moving forward, and we'll be doing so with WellPath and other stakeholders within the county so that we can continue efforts for vaccination within the population. We did have 2 staff that tested positive in the previous month. Presently, there are no staff currently diagnosed with COVID-19. Whoops, I advanced a bit too much there. Okay, so I'd like to shout out to Ms. Love, who is represented within this next slide as well. Today, or not today, but this week is National Nurses Week. So we wanted to take the opportunity as a facility to acknowledge that. Not too many people probably think of correctional health care as a chosen career field for them. Many individuals, when they're going through their nursing education and or preceptors or curriculums and practicums, are going into hospital settings, long-term acute care facilities. Very few people are placed within correctional settings, and because of that reduced exposure, not too many people are considering a career within correctional health care. It is an extraordinary opportunity for individuals, and right now we do maintain a contract with WellPath, who is our healthcare provider. The institution has licensed practical nurses, registered nurses, and certified registered nurse practitioners. We additionally have mental health specialists, physician's assistants, and physicians, but wanted to focus primarily on our nurses this week. There are over 4.2 million registered nurses in the United States and approximately 950,000 licensed practical nurses. There are approximately 149,000 registered nurses in the Commonwealth of Pennsylvania. And if you can imagine sharing that very small pool of qualified staff with hospitals, skilled nursing facilities, long-term acute care, as well as school nursing and correctional nursing, that doesn't afford many opportunities for people to seek us for employment. So we wanted to thank our hardworking nurses who do many services within the institution and let people know that if they are interested in seeking a career, I did verify with WellPath that it is posted on their website, so you can go to www.wellpathcareers.com. You can search for open positions within Thornton, Pennsylvania, and you'll have the opportunity to apply. There are both part-time and full-time positions available. Last week, it was acknowledged within County Council. Governor Wolf had also issued a proclamation, but it was National Correctional Employees Week, or National Correctional Officers Week, it is sometimes referred to as well. So I did include a little bit of the history as well as the calendar of events that took place as we celebrated. This was recognized in 1984 under former President Reagan to highlight the importance of this sect of law enforcement that many individuals, again, don't necessarily consider when thinking about individuals who are providing civil service and safety to our communities. And I wanted to just share some of the images that we were able to capture with our hardworking staff that was able to take a moment to recognize both solemn occasions. We hosted our very first memorial service, and thank you to Councilman Madden and Controller Phillips for your participation. And then we also hosted a barbecue where some of the other photographs were taken so that we could sit and really speak, laugh, share with different staff members. Okay, monthly statistics. Our current population is 1,257 incarcerated persons. Accounting for that is 1,123 county males, 134 county females, 146 lodgers. And as noted in previous meetings under administrative order, we do have a suspension currently of the weekender program, which allows us to keep our DUI building utilized for other purposes. Right now we are doing training within that building. Total commitments within the month of April was 448, and the month preceding was 552. So there was a reduction, which has contributed to the lower population that we presently have in the institution. We also had 541 discharges last month. You had made note about Narcan, and I don't want to steal thunder, but I am really looking forward to the presentation in the future to discuss how that was addressed. On April 22nd, we did have a major incident. This resulted in recreation not being performed on Housing Unit 10 Alpha for the duration of the processing of that incident that resulted in a loss of life. That was the only shift or date within the month of April since the county transitioned to its leadership and management where recreation was not completed. We are continuously recruiting for staff, and I know that's of great interest for many individuals. We are seeking many different positions within programs and support. Our primary focus is still for correctional officers. So on the slide, you can see Major Leach in the top right quadrant, who has undertaken our training department and really revitalized it. He is an extraordinary individual with committed years of service and has led multiple classes already through their training academy that is state certified, and they have completed their graduation. So we have hosted 2 graduations thus far. In the lower right-hand corner, you can see classes 222 and 322. Lower left-hand corner is class 322D. We are going to have additional graduates this week. We will have 10 new full-time officers added to our staffing complement. Next Friday, we anticipate the graduation of 8 additional officers, and the following, we will have 5. We also started a new cadet academy on May 9th. That included 8 individuals, and their anticipated graduation will be June 3rd. Our next academy, scheduled following that, will be on June 6th. It's important to also recognize that we need to continue to get ourselves out there. So people may be aware. If they're not, I hope they're paying attention, that we do still offer a $2,000 sign-on bonus for individuals who are joining our security personnel. We have excellent health care benefits, and the county is supporting all single-tier coverage to be paid for by the county, not the employee, for the duration of this year. This is an incredible career that you can have and be able to support your family, as many of us within the institution have been able to do. We will be participating in an on-site job fair. This is actually going to take place in a neighboring county, Chester. So we will be able to be present on May 14th and 15th from 10 a.m. to 4 p.m. at Chester City Hall. So we hope that anybody who might be interested in applying comes to the job fair and participates and completes their interview. So bring your resumes with you while you're attending. We are also very excited to announce that within staffing and the transitional time period, we did have the opportunity to fill some vacancies within our leadership roles. And we are continuing to build correctional leadership within the institution to support necessary professional growth and development of our direct care line staff. Promotional opportunities were extended to staff to fill the current vacant positions. After nearly 20 qualified staff were interviewed by both majors, Major Pleasant and Major Leach, the committee selected individuals who embody agency values, provide solution-focused ideas, and are innovative in the way that they approach the field of corrections. And I wanted to make sure that I acknowledged and announced that we have some still pending offers to be made. There are 2 sergeant candidates that have yet to receive their offer. That will occur tomorrow. But in the interim, we have 2 sergeants who will be promoted to the rank of lieutenant. And I wanted to congratulate Lieutenant Jones as well as Lieutenant McCafferty. We also have 4 who have committed. I know there's only 3, but I did receive good news prior to the meeting start and could not update the slides that we have 4 committed sergeants, including Sergeant Greeno, Sergeant Guerrier, Sergeant Leonard, and Sergeant Daniels. We're really excited for their training opportunities so that they can learn additional administrative skills. All of those current officers have been impeccable in their career and demonstrating the duties as we would like to see correctional officers fulfill them, and they will carry on those expectations for those that they provide immediate supervision to. Before we move on into the agenda, are there any questions, comments, feedback of what was provided already?
Questions or comments from the board? I'll just comment. I think, as you said, it's an ongoing effort to encourage folks to get into this field and to come work for us, work with the county. And I really, compliment the efforts that you made in leaning into training and, just changing the way in which folks who come and work in this field are treated, and that, this is an area that we deeply appreciate their efforts and their work, and, it's something that we're going to have to continue to do for the foreseeable future because of how challenging the labor situation is.
I have a comment also, if I could.
Go ahead, Raheem.
I just wanted to say, great job, Warden Williams. I've been watching from by afar, and I really appreciate the fact that you're giving out all the information, whether it's favorable or not so favorable, right? I think that's the transparency that the county would love to see in order for us to move forward to be the best prison that we could be in our standards. So I really appreciate the work. I am impressed, and I must say the chatter is getting better.
I appreciate that feedback. And to Mr. Madden's point, I think it's important to acknowledge that I wish that it was just me. It's not. There has absolutely been a shift within the institution. People feel revitalized, employees feel hopeful, and I think that we do still have a significant way to go to ensure that we can get to ideal staffing numbers. But there is commitment and motivation and dedication. The training department is really exciting. The last two graduations that we have had have been really special in the demonstration and recognition of the work that these individuals are choosing. I have said it in other meetings, but law enforcement in general within the nation is struggling in terms of staffing, and those that choose the field of corrections specifically accounts for less than 1% of the population within the United States. And it really is, it takes a different type of person, a different type of skill set, and it takes commitment. We are within the institution for significant time periods that can wear on you. You sacrifice an awful lot and you're disconnected from, society. You are cut off from family. We don't have luxuries like cell phones available to scroll through because we need a mind break. So I think that it's important to really acknowledge that there was an enormous commitment by the staff that was on site to continue to make progress towards all of the things that we want to see happen. Now, before we get into this next section, I will be presenting Inmate Welfare Fund requests to support different initiatives within the institution. In the last calendar year, it appears that routine requests or previously agreed upon contracts totaled $508,864.70 that was paid for through the Inmate Welfare Fund. So we do have some new proposals that I'd like to present for your consideration, so that we might be able to introduce different resources within the institution. The first one for consideration is exercise equipment that is specific for outdoor settings, because these will be placed within the recreation yards of the housing units. It can be utilized when the individuals are out of cell. The only times that it would be prohibited is if inclement weather would prohibit their participation with these different pieces of equipment. Right now, the population is very creative and resourceful, and when they are out of cell, you might see somebody trying to do tricep dips or push-ups on stairwells or tables or stools, and that's, from a safety perspective, not an ideal scenario. So we would like to provide reinforcement for adaptive behaviors for the population in a way that they might be able to engage in some wellness activity. The image on the left is a 7-activity fitness center that is going to be semi-permanently affixed within the recreation yard with tamper-proof hardware, and individuals would be able to conduct exercise utilizing this equipment. We have requested 14 different stations. Now, if you're unfamiliar with the facility, a housing unit has 4 different blocks, and those 4 blocks have 2 separate yards. So the reason why we've requested 14 is to ensure that we can have coverage throughout our general population housing units within the facility so that there's equitable access for the population. We've additionally added within this request 28 of the pull-up bars. So this is something that many individuals do utilize. It has been requested to me when I'm on different housing blocks talking to the population, what would you like to see? This is one of the asks that they have made, which is pull-up bars, and we've asked for 28 of those in order to provide ample opportunity should large numbers of the population want to engage when they are out of cell. The total expenditure request for both of these different items for the full units being requested, which is 14 of the activity station and 28 of the Super Duty pull-up bars, would be $90,346.40 to be expended from the Inmate Welfare Fund.
Right, thank you, Warden. I think I want to make sure procedurally we're going the right route with this. Now, in light of the fact that it's $90,000 in total, though would this all be from one vendor? Is all the equipment coming from one vendor?
We sought multiple bids to get the lowest pricing.
You did
But this particular one would come from one vendor. We actually have separate vendors for each of the requests. This vendor is Pacific Outdoors.
And did we check to see would this be a recommendation by the Jail Oversight Board to County Council to then vote on it, or?
It's not for taxpayer dollars, so I'm still playing catch up here, so we're going to work through this together. Because the request is being made that this would be funded exclusively from the Inmate Welfare Fund, which is, determined by commission rate from commissary sales, and that's maintained within our institution. It's subject to audit, et cetera. That account currently has in excess of $3 million, and the appropriation of those funds or utilization of them needs to be to benefit the incarcerated population, health, safety, and wellness. So I do believe that it meets the criteria, and though I don't believe we're required to do bids for the Inmate Welfare Fund expenditure, we wanted to get the appropriate product for the lowest price. We're not trying to, we think that's a solid practice to maintain, which is how we arrived at this present request. Well, the 4 requests that I will be making.
Yeah, and I appreciate those efforts. What we might do is you may very well be right, given the fact that it's an Inmate Welfare Fund, it may not need to go to council. But what we could do is, if there's support of the board, we can say, yes, we support this, and, to belt and suspenders, it may go before council. But I think either way, this board can.
Yeah, we don't really know, but we'll
opine on
just
it.
make a recommendation. If not, they just spend it, I guess.
Exactly.
Yeah, and I just want to comment that cannot underestimate the importance and, to have these recreational equipment. So it's a really cool thing for you to present this. It's the first time that something like this has been spoken about for, last couple of years on this board. And, when we're talking about, inmates rec time and different things, and I know Mr. King could attest to this with me, is one of the things that has always been known about George W. Hill is there's absolutely nothing to do. walking around in a circle in the concrete, yard that it's called. So to put this in there, it is so beneficial for mental health. It is so beneficial for physical. It is so beneficial on so many aspects. And to identify something specific, from the general welfare fund that benefits inmates, I couldn't think of a better option. So I appreciate you bringing that to the board, and it has my 100% full support.
Thank you.
I'd say this has my 100% support as well. I think it's definitely time needed. I do believe it will need to go to council, though, and I know that we've worked through those accounts, and they are restricted for how they could be used, and they're set up that way in the county financials. So, but I fully support this this purchase.
Just to be clear, from a safety perspective, has this equipment been looked at? Is this specific equipment used in a setting of this sort?
Yes, so this vendor, as well as the kind of brand of the equipment, is specific for correctional settings or detention settings, which means that there's tamper-proof or tamper-resistant hardware that's utilized. You see that there are actual full length instead of pieces, because you wouldn't want something to be able to be broken down or damaged. So there was thoughtful consideration into making sure it would be appropriate, to the degree that we also recognize that it has to be outdoor, resistant to the elements, to make sure that it will also withstand the environment that the equipment will be stationed.
Well, I certainly support this as well for all the reasons you laid out and Mr. Corson did. Any other questions or comments on this before we take it to a vote for recommendation? Hearing none, is there a motion to approve the recommendation of this use of inmate welfare funds?
Motion.
Second.
We have a motion and a second. Any further questions or comments before we put it to a vote? Hearing none, all in favor?
Aye.
Aye.
Any opposed? The ayes have it.
Thank you. The next request, this might seem a little bit strange, but I wanted to make sure that I explained the reason for the request. So within the housing units or housing blocks, there are tables with stools that are affixed permanently to the floor, and that is a safety standard within correctional agencies. As we are moving towards tablet expansion within the facility, and that will also be reported on coming shortly, we've added visitation kiosks on every single housing unit. And the reason for this is that we want to afford increased opportunity for contact. It is very difficult to move individuals with separations or classifications to one location, which is where they currently are able to participate in video visits. It's definitely researched that the more contact that you can have with your family, the better outcomes, supports that you can build during your period of incarceration. If you have children, there's a profound impact on their mental health and well-being too, to maintain that connectivity to parent. So the way that we can increase access is by adding additional visitation stations. To safely do this within the population, these are approved within a number of correctional agencies. They are weighted chairs, meaning that they are structures that are built, again, not with multiple pieces. They are heavy, so you can slide them or push them on the floor if you need to reposition them, but picking them up and using that as a projectile or a weapon would not be a possibility. So it's important that we be mindful, since these will exist within the day rooms or the typical areas that individuals can experience out of cell, that we do not provide anything that could be a potential threat to the community. Now, we had gone back and forth, and we worked with ViaPath or GTL, the vendor, to determine the ways that we would put the visitation kiosks on the housing units. We debated whether or not we were going to do standing or seated to be compliant with ADA, and also very mindful that many of us vary in our heights. The only way that we could really get a uniformity was to have a chair height installation for the kiosks where they will add the tablet and be able to conduct a video visit. So we need to provide chairs. We don't want people to have to squat or stand or do something that would be uncomfortable. We want to encourage them to participate in the length of the visit so that they can just be with their family or their loved ones, which results in our need for these. We would be seeking to purchase 122 chairs. That's how many visitation kiosk stations have been added within the institution, which is pretty profound. And we do hope that the population will utilize this. We sought 5 different quotes specific for this item, resulting in the lowest bidder that could also fulfill delivery within 7 days. And since we do have a very up-and-coming timeline for our tablet utilization, we wanted to make sure that we could fulfill this as well. Each unit would be $257.61. At 122, our total expenditure request would be $31,428.42 from the inmate welfare account.
Questions for the warden? Comments? Warden, I have one. Just from a safety perspective, how would we assure that these points of contact don't open up any extra concerns around contraband or any other kind of concerns around interaction? Because I hear you. I mean, I think from a, allowing folks to have more of a connection with their loved ones on the outside for mental health, I can certainly understand why that's important. But I also want to make sure that we're being, protective of our inmates and our COs from that perspective.
So the important thing to note is that within the software that Viapath utilizes for visitation, individuals still have to add an application. It's free on their phone or their home computer to be able to participate. They have to register as an active verified visitor for the population. So the population can't simply just start making FaceTime calls to somebody. It would have to be with an approved visitor. And within the field of corrections, any phone calls that are made, with the exception of those that are subject to attorney-client privilege, those are subject to recording, as are video visits. So we will be monitoring that to ensure that there is safety, and that's how we plan to address that. I can say in my former facility, when we were able to connect individuals with their family with a higher level of frequency in a very similar fashion, the population was overwhelmingly supportive of that, and they were very willing to comply because they did not want to lose that contact or that privilege. And I anticipate that we would see a similar response here.
So there's no reduction in oversight, it's just allowing
No.
for,
Increased access, no reduction in the way that we would manage that.
Is it all video visits from these kiosks? Is that what?
That is the only purpose for those kiosks.
Okay.
They conduct video visits. When the tablets are not on the kiosk, the video portion will not work. So somebody can't walk around the housing unit on a call, which could be a safety concern. They could not be in their cell on a video call. You can utilize the tablets as a phone call mechanism, and there's also a messaging portion within that as well. It's similar to email or text.
And is this, as you're talking about your previous facility, was this utilized as a privilege? And if there was incidences or issues on the block, a privilege that could be taken away that inmates would have to earn and, kind of respect the rules of and whatnot?
I think in general, most agencies utilize behavioral modification strategies just like that. So we would not prohibit access to necessary constitutionally protected, but oftentimes if somebody is not complying with expectations, that could be a loss of a privilege for them. If we have something going on that housing unit, it would be a loss. But the nice thing is that if there's something going on a housing unit, another housing unit would be unaffected, and they could participate within the visiting, portion.
I don't feel comfortable with it. I don't know enough about it. I think we need to see the vendor come in and show us. I don't feel comfortable with it.
With the chairs or with the video platform?
With the chairs.
Okay.
I was just wondering whether it might be prudent to have like a pilot, like to see what it would look like.
Agree with that?
That might, give an idea of, before you bought 122 of them.
I mean,
Maybe I'd love it, but I don't feel comfortable right
And Judge, just so I'm clear, is it concern about it being able to be used in a violent way, or what's the?
Well, I don't know, I'd like to know. I'm not comfortable with it yet. I think that it could be.
and when is the time frame for the video visits to begin?
We have one-to-one supply of tablets on site right now.
Okay.
We will not have the charging stations for all of them available until mid-June. So that would be our projected timeline. This certainly could wait. The only thing that would be unpredictable is whether or not that supply and distribution response time would be the same. I can't predict
But
that.
if the 7-day consisted, then we would have enough time to have something for the JOB to see and then still be able to move forward in time?
I'm not certain if they can provide a sample, this specific vendor, but I can definitely get additional specifications in the interim, as well as maybe some video images so that you could familiarize yourself before we get an actual sample.
Because, I mean, without the corresponding chairs, there's not going to be much of an opportunity for video visits, right?
I mean, individuals will be able to participate, it just will not be comfortable.
Which, okay.
So they can stand in the kiosk, they just wouldn't be able to sit.
They would have to squat, though.
They have to squat.
Yeah.
Right, set
Or
up.
sit on the
Or
stool.
lean.
If we couldn't have the vendor in, is there the potential of a relatively local location that have these and we could do a visit?
I'll have to research that, Ms. Love, and I would be happy to do that and then reconnect with members of the board so that we can actually have an experiential moment and better understand what we're looking at.
Do you know how much they weigh individually?
I did not add that to the specifications, but I'm certain I could get that. I have physically moved them in the past. This is utilized, maybe not this exact chair. Some of them have arms or armrests. But Norristown State Hospital, who has the forensic population, high level of acuity, these are safety chairs that are utilized within forensic mental health hospitals, as well as many different correctional agencies. But I do respect and value that it's worthwhile to be able to experience this.
Okay, so let's find an opportunity for members of the board to get some more information about this and perhaps experience one for themselves before.
Sounds good.
Because subject to that, I think it seems like it's necessary to utilize to make it a meaningful visit for people. And we've got this investment into the tablets and, and it seems, it makes total common sense that to see your family more, your other loved ones' relationships would be helpful to anybody's well-being, so.
Judge, you support that? Is that the general idea of it you're supportive of? It's really just making sure that
Absolutely. As I said, I may love this. I just don't know enough about it to feel comfortable right now to recommend it. But, I mean, if you wanted to go forward with it, I can. But it sounds like everybody wants to see a little more anyway.
I think that's right. I think I'm hearing a consensus of support for the idea of this, but some questions that we can't necessarily answer now that we'd like to before we make the recommendation formally.
Absolutely. So I have some action items for this one. If we can advance to the next recommendation. So this slide includes two. It's the full narrative, and I recognize that that's very difficult to read. But the county invested within the law library contract. So in the transition, we did complete a like for like. That was something that was maintained by GEO previously, and we did take that on as the county. What we are specifically seeking is the opportunity to provide LexisNexis services on every single tablet. And this is done through a web-based application. This has been verified by both LexisNexis as well as Viapath or GTL to include this on the tablet functionality at no cost to the incarcerated person. The value of this is, again, we have a law library where individuals have to move towards, and we have to keep it, different classifications, different genders, separate, which limits maybe all of the potential opportunities that we would like to see the population explore in their legal access as they are reviewing case law or potentially drafting motions for submission to the court. We would be seeking to increase this availability by utilizing inmate welfare funds. There is a 2-year contract, so it would begin June 1st, again, when we have the capacity to offer availability one-to-one in the population until May 31st of 2024, at which time we would likely be seeking to, support another contract term from the vendor to continue these services. If this is supported, this would be a $1,190 a month essential licensing fee to include this availability on all of the tablets for 24 months, and it would effectively provide all incarcerated person with access to the law library services while they were in their cell and had a tablet, or when they were out for recreation and had a tablet as well. I won't move on to the next one on this slide if you needed to consider or provide or ask questions.
I think it's worth a try for the 2 years and see how it goes if it's used.
I think it makes sense because that also seems that it would just make it more available and save staff and from moving everybody to the law library constantly or getting people enough turns at the law library. And
it's expensive, but I guess we could try it for 2 years, or recommend that it be tried for 2 years and see how it goes.
Is there additional services that the law library provides to an inmate that if they're just looking at it on the tablet, they might miss out on?
That's an excellent question/remark. So I should have included that in the proposal. This is in addition to, not in place of. And in speaking with the librarian, her belief system was that people would be able to actually conduct research independently before they get to law library, where they do utilize a lot of the services that we have. So we have some, I want to say, kind of prefabricated motions that can guide them through that process if they're unfamiliar. And this way they would be able to essentially do their homework and research and then have a very productive session within law library and would not have to go back multiple times to be able to accomplish that one goal. So it is to increase efficiency, not to replace services that we do continue to want to provide.
Okay, great.
Yeah, I personally see no reason not to expand access and efficiency. And I think in the overall scheme of an account that has, I think you said $3 million in it, $14,000 a year is a reasonable one for this. So I'm supportive. Is there a motion to recommend this 2-year contract with LexisNexis?
I'll make the motion to recommend approval of this.
I'll second.
There's a motion and a second. Any further questions on the motion? Hearing none, all in favor?
Aye.
Aye.
Any opposed? The ayes have it. All right. Thank you, Warden.
Thank you. Now, the final request that's also viewable on this slide goes back to recreation. So as Mr. Corson had noted, that the setting for our recreation spaces is concrete. They are designed that way because they are open air so that there is exposure to the elements. Because of that, we tend to go through basketballs pretty quickly. So we do have basketball hoops within our recreation spaces. This is something that people do enjoy, being able to participate in this activity. And this has been previously funded through the Inmate Welfare Fund. I just wanted to make sure for formality purposes as we're moving forward that we have a process in place. We obtained 2 separate quotes for indoor-outdoor basketballs. This was the recommended, and definitely not indoor because it is concrete outside, to have additional wear and tear opportunities. We were able to get the lowest quote from Davis Distributors for $25 a unit in order to purchase 50 basketballs that would allow for hopefully an ample supply as we're coming into the warmer weather months and want to make sure that we have activities for engagement. This would total $1,250 from the Inmate Welfare Fund.
Questions from the board?
I think if they're needed, they're needed. I would say this one does not need to go to council, and you might need one more quote over $1,000, but it looks good to me. And I'm sure that everybody did their homework on that, but I think they're needed, they're needed. This will help people stay active and healthier.
I agree, and I think this may almost seem like a ridiculous question as it relates to basketballs, but I'm going to ask it on anything where we're introducing another piece of equipment to the residents. Anything from a safety perspective that we need to think about with regard to basketballs?
No, for this one, we wanted to make sure that it was durable and substantial in order to meet the needs, but this is not of particular concern. The only
been
risks
used for-
associated are possible
Yeah.
turn to ankles, during a really good game of hoops, but hopefully that will not happen.
All right, is there a motion to approve the acquisition of 50 basketballs at a cost of $1,250?
Motion?
Second.
We have a motion and a second. Any questions or comments? All
May I-
in favor?
Aye.
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 Any
May-
opposed? Am I hearing someone?
It's me, I'm sorry.
Oh, I'm sorry.
I was going to ask a clarifying question of the controller. So you had mentioned that we might need to secure one more quote. May I assume that this is potentially approved, awaiting to see if there are any opposed, not to exceed this amount, but if I do gain a quote that is less than, I can pursue the less
If you
than.
were under $1,000, you're
Good?
You're good.
But, okay, thank you.
Definitely. As someone that just recently was at a sporting goods store to get soccer balls and basketballs for multiple children, it's a pretty good price, so
Yeah, I agree.
absolutely.
All right. I think the motion's been approved.
Thank you. All right, and then in the final portion of my presentation for today, some proposals for consideration. And as always, this is for consideration. We can proceed or discuss the best way to move forward with this. But I have 4 different items, 3 that would be proposal for reinstitution, 1 that would be a new proposal that has not previously existed within the institution. The first item is booking fees. This did come up recently within public comment as to whether or not there would be a reinstatement. I decided that it might be worthwhile for us to formally address this within a meeting and make some kind of determination potentially as to how we would proceed in the future. Historically, George W. Hill had provided a $100, not provided, we had collected a $100 booking processing fee for new commits within the institution. Now, every county correctional agency, I'm not certain if you're aware, but we are asked by the Pennsylvania Department of Corrections to participate in a general informed report yearly. And these statistics are available online. You can see them from every reporting facility. So I did go to that report for the most recent year that was posted to determine how many other facilities were instituting a booking fee and the ranges for that booking fee. We saw $0 from some agencies. The highest was $300 from one agency. The average, when you put all of those county agencies together, not just the ones participating, was around $30, give or take maybe $1 and some change, as the average sum for booking fees. At this time, I'm simply requesting consideration that we reinstate the booking fee to offset some of the costs within the institution, and that is for your consideration.
Do you have a sense of, I guess, first of all, what does Is the booking fee earmarked for any particular expenditure? How does that work in the overall context of the budget for the facility?
So within this, I do believe that it went to the county general fund, but I could be incorrect.
No,
So
I
that
think
was
you're right.
yeah, that was reimbursed in that way. So for the overall processing, which is a process within the criminal justice system, this was to account for and offset the burden of cost from the taxpayer to the individual incarcerated. So that is historically how that has been implemented within the institution.
And do we know what that was on an annual basis when it was instituted, roughly?
You know the dollar amount for booking fees?
$100.
No, the overall.
The overall, we collected, we used to collect approximately $100,000 per month.
Per month?
Somewhere around 1.3 million.
I think we reinstated, we stopped it because of COVID. It was $100.
Yeah, it was a lot.
Yeah, I guess from my perspective, what I'm hearing is that this fee is more than 3 times what the average was in the state. Now, whether that amount gets changed is something that has impact on the general fund. And I guess I'd like to just understand better, again, sort of procedurally, what this looks like. Now, this was suspended by the Jail Oversight Board.
Yes.
So
By
they,
COVID,
during COVID.
right at the beginning, I believe.
Pardon
But
me?
that was right when the board actually the board only came into existence
It was
shortly
stopped
before
because of
that.
COVID.
Right.
Donna Mellon had asked that it stop during that time when people weren't having any visitors.
I mean, the way that I believe that we've handled is that some of the bank accounts that, like for the inmate fund, that's come back, that's in control of the jail with separate accounts. Other accounts are just in the treasury. So this would be a revenue line on the present budget. It would come to the general fund, or in some way it would
Right,
not
to
be
offset
offsetting expenses
The
per
amount of money
se.
the taxpayers are paying to
Yes,
have the
yes, it would,
prison run.
right, and then it would be up to council to allocate how you wanted to budget the prison going forward. But, it's a revenue line, and it's revenue to the county.
And was the overall, as you were looking, because I said, from 0 to 300, what majority of county facilities, did they have the booking fee?
I would say that about a third reported a booking fee.
Okay.
So the challenge for me is interpretation of data, since I was not the collector. I don't know if a 0 indicates that they do not have one or that they failed to
I
report.
think it's a little of both.
Yeah.
Donna Mellon had prepared a report. I don't know if I still have it, but, it's a couple years old at this point. We were right there with the normal.
I mean, it should be an amount that represents offsetting some administrative cost for the county. It's not a tax, we don't want to create the debtor's prison idea that we're burdening people with other fees. But, to the extent that there's authority for, I don't know whether, I guess my thinking would be good to know the authority for imposing a booking fee, if there's a state statute. in
There
the-
must be.
Right,
It's
right.
obviously permitted
I mean, I
under
know
the
it's been
law.
done and it's being done, but I'm not adverse to a reasonable fee that represents the cost to the taxpayers.
No, there's a level of accountability that goes with that.
Absolutely.
That is, is a part of rehabilitation that we talk about. So, absolutely.
Yeah, I'm not opposed to the idea of a fee that's, reasonable, that doesn't exceed into the level of, as you said, Controller, that's, not an overburdening of the inmate population. But I guess, again, I'm just confused about if we were to make a change to the amount, how such a change would occur. And I don't know if the solicitors being on here, if you have any sense of that. That might be a question for the county solicitor.
I'd like to know, when an inmate is discharged, do they carry the booking fee as a liability?
So if an inmate is discharged and they owe any monies to the county, that maintains as part of their permanent balance on their record. If they were reincarcerated or recommitted, that would reactivate and show as an active current charge for them to fulfill. And the way that we recuperate any of these expenses typically is that if somebody, or if they come in with money on their person, that is immediately applied to the account, and we start to collect that by taking 50% of the amount that was deposited towards the credit of any outstanding balance. So we're not taking the full amount. Individuals can still participate in commissary. They can do phone calls and visitation and anything else that would be subject to their contribution financially. But we would be slowly working down that balance with them.
So other than an inmate being discharged and reoffending or being sent back to the facility, if they have that's when the outstanding balance would come up. Like, would it be transferred onto probationary fines and keep somebody on probation for an extended period of time? So it would
No.
only be if they went back to prison that they're responsible for that.
Yes.
Seems
And
reasonable.
I don't know if I said this, but if they have any money remaining on their account at time of discharge, we would be taking the full amount to fulfill whatever debt is owed before we would be issuing them any remaining balance within their account. So if we were deducting at 50% of the deposits that are being made and their account has grown to a sum that would cover it at time of discharge, we would recuperate those expenses.
So, by example, if they were to put in $100, 50% of that, $50 would go to offset this booking fee, bringing their balance down to 50.
Correct.
If they were to continue to put, let's say they put in another $100 without using any of their commissary account, well, I guess that wouldn't really work. But I think I get the point, that if there's anything remaining on what's owed on the booking fee, that would be deducted before the balance is issued as a credit on release.
Yes.
Okay.
So I will, I don't know the level of familiarity, so at time of discharge, we do a procedure where we reconcile the inmate's account to make sure that they are not due any credits from the commissary vendor, that there are no phone charges that we do a full system of analysis to ensure that their money is accounted for appropriately. And then we have, within 10 days, issuing a check that is provided to that person within their name to include the dollars that are remaining on their account. So if there was an outstanding balance that they could pay, let's assume that, I'm incarcerated and I still owe $65 and I have $100 presently on my account, I would be issued $35 at time of discharge.
Well, look, I think now that there is no longer the original reason for suspending this, which was visits weren't available, we wanted to make sure we were providing every possible safe access to friends and family. That's no longer the case here, so I don't think we have any real justification for continuing to suspend this. I will, however, say I think there should be, separately, some consideration about whether this is the right amount, if this should be adjusted, and if so, what the procedure would be. Is that something that has to go before council as well, in light of the fact that it has impact on the general fund?
And for my clarification, I like to know if this is an action item of mine, who will be taking charge of, kind of researching what might be the appropriate amount, and or what would the procedure be moving forward to get this instated?
Yeah, I think it's a question for the county solicitor.
Okay, perfect.
When you ask the county solicitor to answer any questions that you may have per this conversation, I'd like to see the justification for the booking fee, the legal justification.
Any other questions or comments on this item by the board?
Yes,
Oh,
I have one.
Go ahead, Mr. King.
I had a question for Warden Williams, if she may know. What happens to the money for a resident that can't be contacted or reached? What happens to it?
We make every effort to contact, do you want to speak to it,
no,
Joe?
you can say your part, and then I can say what we do after the fact.
Okay, so, during booking or incarceration, we verify address. That is also a typical process within probation as a condition of release for some individuals. So there's a verification process and multiple attempts to make contact to ensure that that individual can have the money restored to them.
And then I think from that point, after a certain amount of time, there is an obligation for the county to escheat the money to the Commonwealth of Pennsylvania, but we're talking in excess of 3 years. So there's attempts to get the money back to people, and when it can't be, there's a responsibility to turn it over to the state, which we do every year.
And timeliness too, so it's important to note that though this is not an ideal scenario, some individuals do revisit within a time period, and if we've not been able to restore them with their funds, that is still applied.
Thank you.
I do think that this board would be the proper body to set the amount of it, and if it needs to go to council, but similar to a fees of the health department or something, this is the body that would make the referral to council, I think, as to what it should be. And I also wanted to add that I know there is interest in improving the booking processes so that there's faster and better communication with the DA, the public defenders, probably private attorneys or whatever. So it seems like this would be a warranted or good use of that to offset the cost of whatever we do in that regard.
So is there a motion to reinstitute the booking fee?
Yes, I think we should reinstitute it at the 100 and then determine whether it should be some other number.
Yes.
Okay. Then I'll make that motion.
Thank you, Your Honor.
Sure.
Is there a second?
Second.
Motion is second. Any further questions or discussion? Hearing none, all in favor?
Aye.
Aye.
Any opposed?
Opposed.
The ayes have it.
The second proposal for consideration is property damage restitution fee. In the Incarcerated Persons Handbook, there is a listing of fees associated. This has been at least established within the handbook. It has not been reinforced within actual implemented policy. And before I implement, because it would be a change, wanted to make sure that I addressed it with the Oversight Board. There is I'll say a listing or an inventory of different items that may be issued to the incarcerated person during their stay, such as towels, uniforms, shoes, mattresses. And then there are also physical environments that are noted within this fee schedule as well, to include things like a damaged light or a broken window or a broken fixture, such as a toilet within their cell that was due to their manipulation, or potentially the locking mechanism on their door. Now, I will say that in initial review, this will need to be updated because of the current market. For the locking mechanisms, I can say that the charge in there is $75, and I believe that the actual rate to fix a door for a cylinder kit is $675. So these fees have not been captured from the incarcerated population in a significant time period, and the building sees that. There is an enormous amount of wear and tear without accountability, and that is problematic, and I do believe needs to be addressed. Now, in terms of finding the equitable or fair way, we would be conducting a facility assessment to determine what is damaged versus what is not. And because we would not be able to maybe substantiate who was responsible for that, that would become our baseline. We would repair that area or replace the item, and then if it is further damaged after that assessment baseline point, the individual would be held responsible and subject to the restitution fees that we would be then absorbing, again, to go to the county general fund and potentially being utilized if proposed and awarded by council to participate in our expense to replace these items within our operating budget.
Questions or comments from the board?
So there's a handbook now where people, when they come in, they believe that they're responsible for damage,
Yes,
but it's not, it hasn't been uniformly applied?
correct.
Well, I hear it's not been applied at all.
It hasn't been applied at all?
I don't know the last
Okay.
time it has been,
Okay.
and I would note that it was likely not uniformly applied.
So, but we're not talking like just wear and tear, so we're
No.
talking like acute, like someone destroys something, basically?
Like I tore my sheets up. To make a clothesline. I destroyed my mattress and blocked my door with it. I damaged the light because I was angry. I jammed a cell lock to get out of my cell.
Stole their court papers down the toilet.
Yes, it's like you've heard some of these stories. So there's, to a degree, I understand frustration, anger, emotion. I very much get that. So though our emotions can explain our behaviors, they don't necessarily excuse them. And that's what I'm looking for is an accountability process. Again, we talked about a behavior modification strategy before. This is to deter or provide a potential consequence that somebody is aware of, that we would definitely educate, this is happening, we are going to be seeking restitution. Think twice before engaging in this behavior that is damaging to the institution as a whole and potential safety of staff and other incarcerated persons.
This would be something that would then be rolled out with notice to people, updating a handbook? I'm just wondering how you would do that.
We would be updating the inmate handbook to accurately reflect some of the charges. I want to make sure that we're also capturing the tablets, especially because we're going to be increasing the number. Those are not inexpensive. And ultimately, if they were all broken tomorrow, I don't think we'd be able to justify as a county replacing those with taxpayer dollars. So I need to put some fail-safes in place to protect a number of different assets. So we would first be updating the inmate handbook. We would then be communicating that out either in town halls, so actual verbal instruction. We could also utilize the current tablets to do a blast notice to the population when they sign on. This is the effective date, and then proceed forward. And we do already have the mechanisms within the inmate account process that we would be able to charge and deduct those fees as described earlier.
It sounds to me that you believe this is in the best interest of managing your jail.
Very much so.
No, I think it's a good proactive stance before you roll out that tablet program, because you're absolutely right. It could, be the difference between deterring somebody that, does something like that, which could ruin the program for people that respect the rules, and that's not fair.
Good point.
So I guess the concept makes sense to me. I certainly appreciate, having accountability for one's actions and damage done to county property. My one just logistical concern would be, how do we arbitrate if there are disputes between the inmate and the staff about whether something was broken in the first place when they, first received such item or they first went into their cell, whether damage was more in the sense of wear and tear versus intentional damage. I guess it's really in the details there where I'm a little conscious of, and I want to make sure that this can potentially be used as a means of retribution or in any way sort of metered out in an unfair way to the inmates?
I think that the hopeful process or fail-safe to prevent such a practice being in place is, as I had discussed, the baseline assessment. I find that to be necessary, especially when we talk about the environment. So in the cell, do you have graffiti and drawings all over the walls? If you do, we've painted a number of cells, and we've gotten the cells back to what they were looking like. And now if there's graffiti, that was you or your cellmate. And we can figure that out through the appropriate procedure in which we do a hearing process with the individuals. They can participate and provide statement. If we can't, for something like a graffiti in a cell and we have 2 cellmates, we may be, if no one owns up to it, dividing that cost in half. Instead of charging both the full amount to paint, we would be seeking the restitution for accomplishing the restoration of the cell by dividing that cost of the 2 individuals within it. In terms of a tablet, it's relatively easy. The last person who signed on is charged for the account. That is something that they're already stipulating to in their utilization of the tablet. So that's a risk that they're assuming when they sign on. That's a statement that they agree to, so we would be proceeding forward in that way. In terms of what they are issued, a mattress, clothing, towels, those are accounted for within our offender management system. You are issued this. Wear and tear of maybe your pants got too long and the hem on the bottom is dragging on the floor, that is not something I would charge somebody for. But people will rip or tear them into shorts. They are intentionally manipulating an item which is not authorized. And that would be a very clear example or standard of how we would be identifying what is intentional versus what is wear and tear.
Well, look, I would take your recommendation as the person who we've asked to run this jail, and I think if your view is that this is the right approach to ensure that there's accountability around property, then I'd support it. But I think I'm just going to be mindful of how this occurs and how we see it sort of taking place, and if we're getting lots of complaints about how it's metered out, we'll perhaps have to look at that. But I'm supportive. Any other questions or comments from the board members about this? Hearing none, is there a motion to reinstitute the property damage charges as laid out here?
I would make an emotion.
Thank you, Your Honor. Thank you, Deb. Any questions or comments? Hearing none, all in favor?
Aye.
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 Any opposed? You guys have it.
Okay, so this one is the last for reinstitution of a previous process that had been exercised within the George W. Hill Correctional Facility. So under previous healthcare contracts, there was a copay process. This was something in many different agencies that was initially suspended when COVID began, because there was a concern that that would deter people from seeking very necessary services. And within disease mitigation spread, you want people to report early, often, and when they might be experiencing a symptom of COVID-19. Many facilities are starting to reinstitute this process as we've seen an inflation and maybe the overutilization of services that are not deemed to be medically necessary, but might instead be an opportunity for somebody to come out of their cell during an institutional count time period and walk to medical to be able to be seen. So we want to make sure that there is an accountability process again. The fee was sent as one of the attachments. The highest dollar amount is $5 for a copay process. It's important to note that this does not apply to chronic care appointments, appointments that are scheduled by the healthcare provider, or assessments or referrals that are deemed by the healthcare provider as being necessary. This does not apply to the routine follow-up for those appointments. It does not apply to prescription medications. So anything that the individual must be provided, it does not apply to that. These would be kind of ad hoc requests from the individual. Much like I said, it's It's count. We've all been told that we need to go to our cells, and I need to be seen by medical right now for a health complaint. If it's deemed that that's not an appropriate utilization, the individual would be charged for their appointment in the total of $5 for a doctor's sick call. For a nurse, it would be $3. Walk-in service unscheduled would be $5, and a dentist would be $5. Over-the-counter medications such as acetaminophen would be charged at the commissary rate. Oftentimes people will say, I want Tylenol because I have a headache. And that's the reason why they've requested to leave their housing unit, maybe during a time when movement is really restricted for a very good reason. They are seen no matter what. So the healthcare provider will see the person. This will not delay their access to care. It will not prohibit their access to care. If they don't have any money on their account, they will still be seen. This is then applied kind of on the back end without the healthcare staff really having an awareness other than the fact that request was made, and then that money is deducted from the account if it is there. If it is not there, the account will just run into a negative balance.
So when you, them being charged after the appointment, so if somebody puts in a doctor's sick call, it's legitimately identified by the doctor that they were sick, are they still charged? Or is it only if it comes out like, oh, there was nothing going on here?
If they're referred at that point from, if they go down to CNRN and are referred to a level above a PA or to that effect, they would not be charged at all for the visit.
Okay, so if something, so individual goes down, it's determined they had a fever, or it's determined there's something here, if they identify that, there's no charge after the fact.
Yes. So generally speaking, as Deputy Warden Mastrodi, and I want to be mindful of those that could not hear her from the public joining because of the microphone, what she was indicating is that typically individuals are seen by a nurse first who can gauge kind of symptom presentation, what might be going on. If they deem that they need to be seen by a mid-level practitioner like a PA, a CRNP, or a physician, then they are then referred. That is not charged. If it was not appropriate, then they would be charged that $3 amount to see the nurse.
I see. Okay, so, because I guess that's my concern as well. I don't want to discourage people from seeing a medical professional if there's a chance they have something, from a preventative perspective, whether we're in the midst of a COVID outbreak or not, I do think we want to make sure that people are seeking medical attention when they think there's a possibility that something's wrong with them. So my question is along the lines of Mr. Corson's, and I guess what you're saying is if they go to, the first conversation they would have would be with a nurse.
The sick call process is that they would submit a request, a non-emergent health request. So that would be something other than chest pain. So I want to be seen because I have this rash on my foot. They would be seen by a nurse first. The nurse would make a determination based on the symptom presentation or nursing protocols or guidelines that are set by the medical director of the facility. So they would be following a procedure or policy that they would then be referred to see somebody to diagnose and treat. If the individual comes for the rash on their foot, but there's no rash on their foot, and instead they want to talk about their friend, that's over in that other visitation room, that would be an inappropriate utilization of funds. So that's the request is to add for people who are seeking services that really are not appropriate utilization of staff resources, and they're also increasing movement within the institution unnecessarily.
So someone goes to a nurse, they do in fact present with a rash, or they have a fever, or there are legitimate symptoms that are of concern. Are they still being charged the fee?
They need to be seen by somebody to diagnose and treat, which would be a mid-level practitioner or a physician, and then they would not be.
Would they be charged the nurse's fee?
Referral fees go to that doctor.
They would be charged, they would not be charged. I wanted to make sure I was articulating this accurately. That's important.
Would the initial RN fee be charged in that case? So I would be of the mindset that in that case, if someone goes to a nurse and they are showing legitimate symptoms, I personally wouldn't support charging them a fee of any sort.
Okay.
I would have to agree with Chairman Madden on that. I thought the way you first explained him was goes to the nurse. If it's a legitimate, I have a temperature, I'm sick, that's legitimate, you should go to the nurse. It's taken care of, no fee. If it's identified, like you said, Warden, I have a rash, no, you don't have a rash. The consequence of playing sick was the copay. I don't think it's fair for anybody that's seeking medical treatment for legitimate medical needs.
Yeah, I mean,
I agree. I agree.
For me on the outside of jail, $3 doesn't seem like much money. But if I'm incarcerated and I only have $4 in my account and I have no means of getting any more money on it, I may be disinclined to go to the nurse if I think I'm just going to lose 75% of what I have. And I don't want to do that. I want people, if they have legitimate symptoms, I want them to see medical attention.
So I think one of the benefits of having the discussion is that this informs and implies policy moving forward. So we can ensure that even though the historical practice was, as we've talked through, that it sounds like what does have support is that care that is deemed not appropriate utilization of services, the playing sick, as Mr. Corson said, could be subject to a fee if we move forward. Anything else that was deemed, yes, you did the right thing, thank you for reporting, now we can take care of this and we can treat you, would not be subject to a fee. And that would be something that we as an institution provide because medical care is necessary.
I'm only one voice, but that would be my view.
I agree.
I agree. I agree.
Yeah, I'm thinking that I think people should report, especially that we're still in COVID times, and I'd rather people report and not worry about a fee. I also thinking that if a little bit more time went by, we'd have a better sense if you're really, really suffering from the playing sick part. I mean, it is a burden. I mean, it's clear that it would be, but at the same time, we haven't had to operate it that long to know how detrimental it is in terms of magnitude. So I'd give it more time.
But to your point, it cuts both ways. I mean, if we
Yeah.
have too many people going for illegitimate reasons, they're straining the system that should be going toward people who actually need it. So I do agree that there should be some penalty for, use of services that are deemed unnecessary. So, any other thoughts on this from the board?
Just one thing, and I don't know if it gets in too much to be able to track. If there's an opportunity for like a tier system of a frequent flyer for this. So somebody had already gone, it was deemed inappropriate. Okay, you got your warning. The next time, you will be charged this. And I don't know if that's too much work going into it,
Sounds
but it's
like
just
it.
something that, was kind of crossing my mind.
Well, I guess what I would say is this isn't going to be set in stone, right? We can move forward with something today, and if in the months to come we're hearing, through direct means or through the warden and staff that this needs some adjusting, we can always consider that.
And you're welcome to consider the rate schedule as well. I simply provided the historical context of what was charged in the past when this was in process. So that can certainly be up to determination as well. In consultation with the healthcare provider, they weren't subject to an amount. WellPath is not going to be getting this. Again, it would be funneling through the similar processes that we would be gaining kind of restitution from. But they do support an accountability process.
So I would make a motion to reinstitute the fee schedule as laid out with everything you have in this. I don't think we have to read the whole thing, but if this is going to be part of the public record, I would support it with the exception that I would amend this by adding further that none of these fees shall apply for reasons shown to be for legitimate symptoms. If that's, is that language clear enough? Does that need to be clarified for you, Warden, or for the Deputy Warden?
Could we summarize it as validated reported health complaints are not subject to a fee?
I'm good with that.
Yeah.
Okay, so I made the motion. Is there a second for that?
Second.
Motion is second. Any further discussion on this matter?
My only comment would be that if we could get a report back at some point of what the magnitude of these fees are coming in.
I think what would serve us best as we're evaluating kind of the outcomes of these decisions is to include this routinely during these meetings so that we can then have some data to get further discussion and then make determinations whether or not we need to pivot or modify some of these recommendations.
I think that's
Okay.
a great.
I think that's a good idea.
Yeah, and
Yeah.
what I would also say is as a baseline, if you could report what April was prior to these fees going in place, that could be useful to see how much it's impacting the use of services.
Absolutely. So we do, our healthcare provider does typically track points of contact or encounters for sick call or chronic care, so we should be able to provide that information as well.
Can we make that a part of the regular warden's report? Would that be appropriate?
Sure. It can either be part of my report or the deputy warden's report, but we will ensure that that is represented within our monthly numbers.
Yeah, because I think it would be useful to see if there's a sudden spike in usage or diminishment, it'd be good to know.
Absolutely. I'll see
Could I,
if
could
we're
I
able.
also,
I'm sorry.
Go ahead, Ms. Love.
oh, thank you, Chairman. Warden, would this also include the number of false calls versus actually treated individuals? I mean, I think that's important to see as well, because that's a use of valuable resources if there's a lot of fake calls.
So I don't believe that the contract provider has been tracking that historically, but I think that we will devise a way to see how we would delineate that. We would certainly be able to see it in the reporting mechanism of, sick calls scheduled, seen, no health complaint validated, charged in the future. But I don't believe I would be able to do that in retrospect from the beginning of the contract.
Right.
Oh, that's okay. I just think, now that we're doing something, we ought to give as much data to those visits as possible. So thank you for considering that.
Absolutely.
Thank you, Ms. Love. Anything further on this one? Hearing none, all in favor of the motion?
Aye.
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 Any opposed? The ayes have it.
All right, now my final proposal, and then I'll get to pass the microphone to Deputy Warden Falley and Ms. Shaw. We are suggesting, as we've been evaluating different process efficiencies as well as potential costs that would be burdened to the county, when individuals are discharged, if they have less than $1 on their account, we are still going through the entire validation process, issuing the check, making sure that's getting mailed in an envelope. It is an enormous amount of work and resources that is going within this process. And for those that have substantial dollar amount, they should be awarded that. But for 12 cents, it seems a little bit inappropriate for our resource development. So we are requesting at this time, and this is a new process, that when we have done the appropriate reconciling and determined that an incarcerated person's balance is less than $1, we would be not issuing them a check for that money. We would be taking that from the account and effectively placing it into the inmate welfare account. So this would not go to the county, but it wouldn't cost the county to go through this process. And then it could be utilized for future initiatives for the population. 12 cents will add up if it's many people in a day. So we'd like to kind of pinch pennies and make sure that we're doing the right things by all. And this is our current proposal for the board's consideration.
I totally support that.
Absolutely.
Too much cost and administration for no money, really.
Yeah, I agree. I feel like less than $1 can be deemed de minimis. And, all resources are limited resources, and if we can allow for the resources of the county to be put elsewhere toward the running of the jail, that's in the best interest of everyone. So I'm supportive of this. And as you said, it's going into the inmate welfare fund anyway. Okay, is there a motion to approve this?
Motion.
Second.
Further discussion? All in favor?
Aye.
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 Any opposed? The ayes have it.
I very much appreciate your patience as well as your consideration. My portion is not typically this long, so thank you for allowing me to speak upon different improvements and things that we've done in order to strategize. I would now like to turn over the presentation to Deputy Warden Falley and Ms. Kelly Shaw, who is our Reentry and Program Administrator, to provide an update within their departments. Thank you very much.
Thank you, Warden.
Thank you, Warden. Good evening, Chair,
evening.
what's up, Board? I'm not going to bore with the data because we already sent it to you last week. Just give you a brief overview. Last month when we met, you guys met the program and support administrators. You guys met Joanne Skruski, my education workforce development. You guys met Ms. Pat O'Connor, my substance use and mental health administrator, and Reverend Cochlea Dunn, who's our chaplain. So I'm going to go briefly with each department, just vaguely. As far as education and workforce development, we currently have 9 new enrollments, and out of the only 3 individuals received their GED. We're still in the process of hiring an academy instructor, and the math component of the GED is the one where our incarcerated persons are having a really hard time passing. The other component of Ms. Skruski is the workforce development, in which is building up strategy to recruit potential employer to provide access to job when they get released to the community. In total for 2022, we only have 15 incarcerated persons that received their GED. Substance use disorders. So we hired Ms. O'Connor, who's our substance use administrator, and Mr. Corson, you'll be very glad that last month we only had 9 Narcan. This month we have a whopping 128. And when Ms.
Say that number again?
128 Narcan distributed.
Wonderful.
I have to give a special shout out, I have to say shout out, to the intake and discharge team, and they did an amazing job. When we took over, we acknowledged that those numbers was very low because Narcan is extremely potent. Since 2020, there was only less than 205 Narcan distributed. So we met as a team, and Ms. O'Connor built a nice education one sheet, and the intake and the discharge team, they came together and came up with a strategy. So special shout out to Major Abel Pleasant, Major Lieutenant Terrence Moore, Lieutenant Platt, and last but not least, Sergeant Darrell Williams. And his team, they really came up with strategy. They were innovative. We put it with the case managers. They read it, they educated, and that's how our number increased. And we started around April 15th, so I'm looking forward for the whole month. Hopefully we'll increase those numbers.
That's excellent.
The other strategy that we're trying to do for substance use is we're going to start opening a therapeutic community for the women. We're going to start with the women with a pilot, and Ms. O'Connor and her team, they're coming up with strategy where we're going to start it for the month of May. But for now, we only have PrEP. We extended PrEP. We have no waiting list. For the month of April, 42 enrolled for PrEP 1, 11 for PrEP 2, and we have 19 new enrollments. Our drug and alcohol liaison from adults in probation received 70 inpatient treatment referrals. For our mental health liaison, we have a total of 9 referrals waiting for 4 orders, 9 referrals waiting for North State Hospital, and 3 diversion wait lists. AA, we're going to start AA for female on May 16th, next week. The two volunteers came to our orientation last Saturday. I met with them. I'm looking forward for them to implement those AA groups. Religious services, a very, very important department with us. As Warden stated, we did have one death. We have 8 family death notification. Death notification meaning that incarcerated person's family died, and the Reverend has to go and provide grief counseling to them. She did 15 counselor visits. There are 92 individual volunteers. We did 393 religious services. Out of 393, 15 were Catholic, and there was 378 Juma services. Last month was Ramadan, and we served 93 incarcerated persons. As far as our first life skill program, we did a life skill threshold, which is pretty much a 6-step decision-making process. Out of it, there were 13 participants, only 6 completed it. And for the month of April, we had 5 new enrollments. Any question regarding this portion?
I do, and it's really just a request. This is great information, and I'm happy to hear the advancements that we made in a few of these areas. What I would request is just in terms of information sharing, if it would be possible just to look at this, perhaps it's every quarter or so, we look at how these numbers are trending so that we can just sort of see. There may be very valid reasons why some of the use of services are increasing. It may be very valid why they're decreasing, and either of those movements may very well be good news or bad news, but I think it's useful for the Jail Oversight Board and the public to understand how these trends are looking longitudinally.
Yeah, absolutely, yeah.
And I just, I had a question about the new therapeutic community opening. So for the females, is that that's gonna be will that be a separate block that they live on continuously?
So the female are already on our housing unit 9.
Okay.
So we already identified the women that qualify for that program, and we're working with strategy, and we're in the implementation phase.
Okay, so will the females that are participating in TC, will they be separated from the general pop on that?
Correct.
Oh, okay. That's, I mean, to hear, the benefits of a therapeutic community is, absolutely, because it's not just about, a drink or a drug. I mean, when we talk about behavior modification and criminal thinking, so to hear that Delaware County is bringing that back, I want to, personally thank you and the warden for putting in the work to do that. Because as an individual that participated in a therapeutic community 18 years ago and sitting on the Delaware County Jail Oversight Board today is proof that, that really absolutely works. So I'm very excited to support this initiative.
Thank you.
Deputy Warden, I just have one other question. Do we have a good means of getting feedback from those who are utilizing these services so that we know where there are areas to continuously improve them?
So we're currently designing a survey to see what are the needs of our incarcerated population. So once we finalize the survey, we're gonna distribute to our population, and I think we're gonna use a tablet, and make sure we talk more about the tablet component, but it's in the works.
Great. Any other questions from the board before the Deputy Warden moves on? Thank you, sir.
Thank you.
Thank you.
Michelle?
Good evening, members of the board. It's been over a year, and we proudly announce the return of our full-time wellness instructor, Greg Beedling. Greg Beedling returned from deployment on April 18th. We thank you, Greg, for your service and are grateful of a safe return. Having a full-time wellness instructor provides opportunity to educate and encourage incarcerated persons to better understand their own health and promote activity to support a healthy lifestyle. And with the addition of the requested outside yard equipment, we can further enhance healthy lifestyle and habit. Currently, Greg is working with our juvenile population on a daily basis. The wellness program will extend to our adult male and adult female population within the month. Reentry update and progress. In the month of April, 10 sentenced incarcerated persons were released. All accepted reentry service and received an individualized resource packet. And in only 6 months post-transition, we're welcoming our first new community service provider. Education Data System, Inc., known as EDSI, is a nonprofit workforce development and consulting organization that will provide a job readiness workshops to the population. EDSI staff completed volunteer training last week, and within the month will implement job readiness workshops. Thank you to Major Leach and his training staff for modifying their schedule to provide volunteer training. We're eager to begin the partnership with EDSI while connecting our population to a community resource that provides wraparound service. For the ViaPath update, video visits continue to run 9 a.m. to 12 p.m. and in-person visits 12:30 p.m. to 8 p.m. A reminder to the public, all visits must be scheduled online. For the tablet 1-to-1 ratio expansion update, on-site field assessment begins next week. The full inventory of tablets are on site. Half of the rolling charging carts are en route, and we expect to have the majority of supply early June. Currently, we meet bi-weekly with ViaPath project manager to verify progress. To ensure IT capacity, all staff training will begin the first week of June to include external mail scan training. External mail scan will begin Monday, June 20th, which means all personal mail, such as letters, drawings, and pictures, will be digitally delivered to the population. Notification of the new process will be posted on the George W. Hill Correctional Facility website by the week's end. Email blasts of the external mail scan procedure and start date will be sent via gettingout.com at the 30 and 15-day mark. And just for your information, gettingout.com serves as a portal for depositing funds and friends and family to send messages to the population. ViaPath educational materials are on site and will be distributed to the population at the 30-day mark. We recognize that first, the population must have the opportunity to access the tablet, and then we can implement the external mail scan. The June 20th external mail scan start date will accommodate such. Any questions?
Questions from the board?
Thank you.
Thank you.
Thank you, Deputy Warden. Good, okay. Next item is subcommittee reports. Anything for today from the subcommittees? Hearing none. Next is last round of public comments. Anyone from the public? And then last and finally, any further board member comments for this evening?
I just want to make
This
a
is
quick comment, but go ahead.
Go ahead, Ms. Love.
No. I've been a member of this board and for probably 1 year or less of the prior board. It was always reported about the number of vacancies or, in the positive, the number of positions filled. As this board, the current board, took the action to improve the safety and security under the guise of going from a privately owned to public control, we have not reported that statistic. I feel that that's an important statistic, and I particularly feel it's very important because of all the hard work the new organization has done to try and fill positions. Positions filled is important for safety of not only the employees, but of the residents, and it's important for the residents, the entire residency of Delaware County, to know what this movement from a privately owned jail to owned by the county, and what what is happening with it. We've discussed statistics for almost 2 hours of the improvements, and they're wonderful statistics. I just think we're missing the mark by not sharing how safe we are keeping and how we are working towards making a safe environment. I think it's a statistic that we're missing in the public domain. Thank you.
Thank you, Ms. Love. And I will respond that I do appreciate your desires, which I think we all share, for transparency where it is in the best interests of the safety of our inmates and our workforce. And when there is a third-party vendor who we are responsible for holding accountable to abiding by that contract, when there are staffing penalties that we are receiving that are predicated on what the staffing levels are, and when we need to take every effort to ensure that that third-party vendor is doing everything in their power, including paying people market levels, et cetera, to appropriately staff, that is a very different circumstance than when the county is managing the jail directly. So I think we can speak, which we have today, about the importance of continuing to go out and hire and to train and to make the efforts which we have in improving our staffing levels. But absent a third-party vendor who we are holding accountable, there is absolutely no justification in the interest of the safety of our workforce and our inmates to be overly specific about staffing levels when such information could be used by inmates to compromise the safety of our workforce or their fellow inmates. So I am steadfastly opposed to over being transparent when it compromises safety, and it is a very different environment when we're not holding a third-party vendor accountable. So I hope that's an understandable addressing of your concerns, Ms. Love. You may or may not agree or disagree, but that is my position, and I don't see it changing.
Thank you for your response. Of course, we're on opposite sides of this, but I appreciate your response. Thanks.
Any further comments from the board?
Yeah, I wanted to make a comment. Councilman Madden and I were able to attend the ceremony for the fallen corrections officers last week, and it was a very moving ceremony, and it was great to see our employees, and I tried to welcome them to the county and said thank you for either staying or joining. I also wanted to say that I was able to go into the business office, and behind the scenes of all the work of the corrections is all the business people. I never really got past the front door, and I was able to go in and see HR and our Lisa Mastrody's people for payroll, and I wanted the community to know that we were able to put in systems that got people paid and that people worked really around the clock to get that done. It was all new, 24/7 timekeeping and payroll management and HR management. And I just wanted to say it was really impressive work that was done in the past, for months and months, but in this last crunch time, it was really successful, and I appreciate being invited up for that. So thank you.
I just wanted to quickly address Warden Williams and your team and just thank you for all the information that you brought today and all the proposals. And looking through this, exercise equipment and different things, and also, some fiscal responsible things like for the county, which shows that adding things to the population and increasing privileges are not mutually exclusive of financial, responsibility. And I just encourage and challenge you and your team to continue bringing forth things like this. I mean, I feel like had the opportunity to sit here today, a month after the county taking over the prison, and really be a part of some real changes tonight. And so I want to commend you guys for that. I look forward to continuing that. So thank you.
You're here. And I would say it is wonderful to be able to finally get past the immense amount of oxygen that had been consumed over the past few years about deprivatization, and to spend time talking about ways to continuously improve the jail and its management for all involved. Anything else from the board? If not, I'll entertain a motion to adjourn.
Motion.
Second.
All approved? Any?
Aye.
Any opposed?
About 5 minutes.
The ayes have it. Thank you all.
Thank you.
You too.
Bye.
Take care.